Hi, I'm Dr. Carl Pesta. Welcome, and thank you for taking an interest in McLaren Macomb's Bariatric Surgery Institute. I'm a bariatric surgeon and medical director of the program here. We're very happy you've decided to look into bariatric surgery. I'd like to dispel a few myths about the disease of morbid obesity and the treatment bariatric surgery. A lot of people think that bariatric surgery is just for the people you see on TV, the super morbidly obese, the over 600 pounds, and that really couldn't be further from the truth. Bariatric surgery is a well-known, very safe treatment for the disease of obesity, whether it's the beginning stages or the severe stages. We see people come to us who are desperate, frustrated, and are looking for a solution. The surgical treatment for obesity is now well established. We know it's a safe operation, and it's not just for the super morbidly obese. Patients who have maybe 80 pounds to lose or 100 pounds come to us frequently, and they seek treatment because they've tried everything else. They've tried diets, they've tried exercise programs. And the thing with that is that we know the disease of obesity is not just overeating and not exercising. There's so much that goes into the disease of morbid obesity, from hormones to other medical issues, to emotional issues, to behavioral issues. And we address that here at the Bariatric Surgery Institute at McLaren Macomb Hospital. So I'd like to explain to you a little bit more about how the surgery works and how we're able to help you with these other diseases that are attributed to morbid obesity. You know, people come to me sometimes frustrated, sometimes just tired, but sometimes also excited that they have the idea that their lives are going to change. From the fatigue, from the medications, from all the other issues that occur with the disease of morbid obesity, with an opportunity to change that. They go through their operation, they stay at the hospital for a day, then they're home, and that's when things really get to change. Within the first few weeks, you start to notice how things are going to be different. You're eating healthier. We'll guide you through our nutritional plan. And as the weight starts to come off, so do these illnesses. You'll notice that your knees don't hurt anymore, your back doesn't hurt anymore. You're able to come down on some of your medications. Maybe even get rid of that sleep apnea mask if you use that. So it's really an opportunity to change things around in a dramatic fashion. And what to expect after surgery? Well, things just get better and better. I see countless patients come to me. Dr. Pesta, I can't tell you how much this has changed my life. Some patients even change their birthday to their surgery day. It's changed their life that much. And when they tell us of how now they're active with their family members, when they're doing more things that they never did before, when their friends and family start to notice their successes, how much it has really made a difference for them, just through a 1.5 hour operation. Now that you've made the decision to pursue bariatric surgery, I want to take you a little bit through the process. Everybody's insurance is different, but most insurances do cover the procedure. We will help you and guide you and hold your hand through the process because there can be a lot of red tape. Sometimes it can take even up to a year depending on your insurance. But don't let that deter you. We have so many patients say, I'm so glad that we were able to get me through this process. I'm so glad that you were holding my hand. You made it so much easier. And so when it is time for surgery, that's just the beginning. In fact, we start even before that. We have educational classes. They're going to help you to learn with your surgery. Because it's not just having a surgery and then going back to your old way of life. It's a completely different way of life. And we help guide you through those changes. Through nutritional coaching, shopping, dietary guidance, exercise guidance, emotional support. We have countless meetings that give you the support that you need to help you have success with your bariatric surgery long term. In fact, I see my patients lifelong because I love to hear the success stories. Another story I'd like to share with you is a patient named Lori. She came to us significantly over her ideal body weight, but she wasn't able to get pregnant, and that was her dream, to have a child. She went through her bariatric surgery, and after losing over 200 pounds, she was able to become pregnant and have a beautiful child who I've now been able to see grow throughout the years. And that's just the beginning. I hear so many stories of how lives have changed through weight loss surgery. And we hope that you'll continue to pursue that as well with us. Some of the other myths that people think may be a barrier to bariatric surgery is age. We know by the studies that having bariatric surgery, if you're morbidly obese, can add 10 to 15 years onto your life. So we've operated patients as old as 75, because who couldn't use another 10 years at the end of their life? It really makes that much of a difference. Other things like prior surgery, we're used to dealing with that. If you've had other operations within your abdomen, we can handle that as well. And I'd like to share another story with you of a patient experience. Just the other day in the office, a wife came to me and pulled me aside and said, "I really want to thank you for what you did for my husband. He's never been so active, so affectionate, and so loving to our children because he can participate again in their lives." And to me, that gives me the drive every day to come back and do what I do and what I love to do in bariatric surgery. The stories go on about successes and how it's changing lives and improving health. And I think that's one of the most important things that we can do in healthcare.